Hi, my name is Kristi Cox. I'm a student physical therapist assistant, and I'm going to be presenting a journal review on passive versus active stretching of the hip flexor muscle in subjects with limited hip extension. It was a randomized clinical trial. Not only did our subjects have limited hip extension, they also presented to the study with lower extremity injury or low back pain due to their hypoextensibility of their hip flexors. Passive ballistic and PNF stretching have been shown to improve or increase range of motion. Active stretching, though, has been shown to improve the function of the antagonist muscle as well as increase range of motion over passive. So let's take a look at our subjects. We had 45 subjects, 23 being male, 22 being female, between the ages of 18 and 65, who presented to the study with lower extremity injuries or low back pain. The subjects were screened using a modified Thomas test to determine their hip hypoextensibility. Decreased range of motion was due to the hip flexors, but also might have led to concern of further injury. The design of the study included a goniometric measurement of the hip flexors at baseline, 3 weeks in and 6 weeks into the study. Our independent variables included passive and active stretching, and the dependent variables included hip extension. We had 2 groups, passive stretching group and the active stretching group, which were randomly assigned. The modified Thomas test included the patients were instructed to sit at the edge of the table as close as they could by then grabbing their knee and pulling it into their chest, slowly lowering their back towards the table. They were asked to maintain a posterior pelvic tilt as the examiner recorded a goniometric measurement at the hip using a standardized goniometer. And this is a picture of the modified Thomas test. So the design of the study included a passive group, which were the participants were asked to perform modified lunges and also a prone static hip stretch. The modified lunges, the participants were asked to kneel with the ipsilateral knee on the ground while maintaining a erect trunk and chest. They were then asked to maintain a posterior pelvic tilt and lean forward into Hi, Nancy Casey. The design of the study included a passive group, which the participants were asked to perform a modified lunge and also a prone static hip stretch. The modified lunge, the participants were asked to keep their ipsilateral knee on the ground while maintaining a erect trunk and chest. They were then asked to maintain a posterior pelvic tilt while leaning forward by flexing the contralateral hip and knee. This maximized the stretch of the ipsilateral groin. The next stretch included or asked the participants to maintain a prone position while resting their distal thigh on a towel roll. Each of these exercises were performed for 10 reps and held for 30 seconds. Oh, I'm sorry. The active stretching group were asked to perform prone leg lifts with knee bent and prone leg lifts with knee straight. The prone leg lifts with knee bent, the participants were asked to maintain a prone position while flexing their knee to 90 degrees. The participants were asked to relax the hamstrings while contracting the glutes to lift the thigh up off the table. The same instructions were given for prone leg lifts with knee straight, only the knee was asked to remain fully extended. Each of these exercises were performed for 10 reps, held for 30 seconds, with up to a 30-second rest in between reps. "33 out of 45 of our subjects completed the study, 15 being from the passive group and 18 being from the active stretching group. The passive stretching group saw 12 degrees more of hip extension range of motion at 6 weeks, and the active stretching group saw 11 degrees of increased hip extension range of motion. Both passive and active stretching groups saw improvement in hip extension range of motion. The passive stretching increase was thought to be from the tensile stretch applied over time, causing the muscle to relax, improving range of motion. The active stretching increased range of motion was thought to also from the tensile stress applied with additional reciprocal innervation, increasing muscle length through relaxation. The increased flexibility from both of the groups was thought to be contributed to tensile stretch because it was a common factor between both the passive and active stretching groups. The improvement of hip extension range of motion in the passive stretching group was thought to be from the tensile stretch applied over time, causing the muscle to relax and improving an increased range of motion. In our active stretching group, the increased range of motion of the hip extension was also thought to be from the tensile stretch applied, but also from the additional reciprocal innervation, increasing muscle length through relaxation. The increased flexibility of hip extension was thought to be contributed to tensile stress because it was a common factor in both the passive and active stretching groups. Our results of the study supports passive and active stretching for increased range of motion and flexibility of the lower extremities that cause low back pain or lower extremity complaints. And that is all. Any questions?